$11,000. Billed for heartburn, not a heart attack. She had insurance the entire time. So why didn't it protect her?
A decision made 100 years ago, during World War II, quietly built the most confusing healthcare system on Earth. Here's how.
There's a hidden company inside your prescription bill almost nobody's heard of. And it's why you're prid of. And it's why your premium doubled in 15 years.
$11,412. That's what Sarah Martinez was billed for 4 hours in an emergency room, an EKG, and a blood panel. She didn't have a heart attack, she had heartburn from a burrito. And here's the part that should bother you more than the bill itself. She had insurance the entire time. By the end of this video, you'll understand exactly how a woman with insurance ended up owing more than most people's monthly rent for indigestion, and why that same math plays out in kitchens across America every single day. The United States spends more on healthcare than any country on Earth, yet somehow that spending buys confusion instead of confidence. To understand why, rewind almost 100 years to a decision most people have never heard of but that still shapes every bill Sarah and you will ever receive. During World War II, the government froze wages to control inflation. Companies couldn't compete for workers with bigger paychecks, so they got creative and started offering health benefits instead. Because those benefits weren't taxed as income, both employers and employees liked the arrangement, and it stuck. But here's the twist nobody talks about. This wartime workaround didn't just create employer insurance, it created a system where the person using healthcare was no longer the person shopping for it. Your employer picked your plan, your insurer negotiated on your behalf, and once insurance companies became the ones doing the negotiating, hospitals adapted by inventing a whole new kind of price, one built to be negotiated down, not actually paid. That's why a hospital's official price for an MRI might read $2,500, even though almost nobody pays that. Think of it like a car dealership's sticker price, except the sticker was never meant to be honest. Insurance companies negotiate that number down, sometimes by 70 or 80%. And here's the part that explains Sarah's bill. That negotiated discount only exists if you have an insurer at the table fighting for you. Walk in without one, or walk into an out-of-network room like Sarah unknowingly did, and you're handed the sticker price in full, sticker shock included. So who actually benefits from this game? On paper, you do, because your insurer's negotiating power is supposed to protect you. But you're also the one paying for that protection, wrapped quietly into your monthly premium. You're paying your insurance company to shield you from a pricing system that only exists because insurance companies got involved in the first place. Now here's where the story gets stranger and where most explainers lose people, so let's make it human. Imagine every insurance company as a giant shared piggy bank. Healthy 25-year-olds who haven't seen a doctor in years are dropping coins in. Cancer patients and people with chronic conditions are pulling handfuls out. That's the whole idea behind
insurance, spreading risk across a crowd. But it means your premium isn't really priced on your health. It's priced on the health of total strangers in your risk pool. If your employer hires a lot of older or sicker workers next year, your premium could climb, even if you never set foot in a doctor's office. Then there's the paperwork war, and this is where it gets almost comedic if it weren't so expensive. Every insurance company employs teams of people whose entire job is deciding whether to approve or deny claims. Every doctor's office, in turn, employs its own team just to fight those decisions. Two armies of paperwork negotiating with each other over Sarah's blood panel. Estimates from health policy researchers, including groups like KFF, suggest administrative costs eat up somewhere between 8 and 15% of every healthcare dollar spent in the country. That's not medicine, that's not doctors, that's the toll booth fee for two bureaucracies talking to each other. But wait, because there's a third player hiding in Sarah's bill that almost nobody's ever heard of. Somewhere between the drug manufacturer, your insurer, and the pharmacy is a company called a pharmacy benefit manager. Their job is to negotiate drug prices behind closed doors, and their profit often comes from the gap between what they pay manufacturers and what they charge insurers, a gap so opaque that even people working inside the healthcare industry struggle to explain it. If insurance is a black box, this is the black box inside the black box. Layer all of this together and you get a bill like Sarah's, and a country where the average family now pays well over $20,000 a year in combined premiums and employer contributions, according to KFF's annual survey data, roughly double what it was 15 years ago. Wages haven't come close to doubling in that time. So ask yourself,